From the Uniontown Hospital studios at your local station WMBS, this is Medicare A to Z on What's on Your Mind with Aaron Zolbrod, brought to you by the health insurance store in Connellsville. And we can get to say for the first time this year, Aaron Zolbrod is with us. Happy New Year. We didn't get a chance to talk last
Happy New Year. I ask a lot of people, what is the etiquette for wishing people Happy New Year? Is it the 5th? It's the 10th? Is it the 15th? Yeah. What is the Happy New Year etiquette?
Yeah, exactly. At what point is it no longer new?
I think you said if you haven't seen somebody yet,
right,
it's okay. So I haven't talked to this audience. So Happy New Year, WMBS listeners.
And Happy New Year. I will speak for the listeners. Happy New Year right back to you.
Thank you.
So we are talking, of course, with Aaron Zolbrod from the health insurance store. 724-438-4593. If you have a question about anything to do with health insurance, we will be more than happy to ask about that, whether you have a personal health insurance issue or you're running a business and you would like to either offer health insurance for the first time to your employees and you're just kind of going, what do I do now? Or if you already have health insurance as one of your benefits, but you're thinking maybe I can do a little bit better, both by my employees and by the bottom line, then give Aaron a call or call us right now at 724-438-4593. And as we do every time, because there are some folks who may have just moved into Southwest Pennsylvania or maybe don't know, but what is the health insurance store? What's your history and what do you do?
Geez, Bill, you pretty much just did it for me. I don't know how much more I need to say,
well,
group health insurance,
question,
individual health insurance, Medicare insurance. That's what we do. I'll tell you what we don't do. We don't do auto. We don't do home. We don't do life. We don't do any of that. We do all things health insurance. You mentioned it. If you're an employer, you own a business, you either want to provide your employees with health insurance, which I think is probably one of the smartest moves you can ever make if you own a business, just for recruiting quality employees and retaining them. If you are on Medicare, that's really probably about 60% to 70% of our clientele are people on Medicare. We do supplements, advantage plans, Part D. And then also we do insurance for individuals, which is a big deal in this time because people are getting laid off. They're retiring earlier. If you're working for somebody who doesn't provide you health insurance, if you want to retire pre-65, if you've been laid off, we get those calls, those emails and calls on the daily. We help you choose a plan through the marketplace, Obamacare, the Affordable Care Act, whatever you want to call it. We are brokers. That's probably the most important thing, that we are not employed by any insurance company. So we can provide them all. Obviously, who the two big boys are in this market. We are appointed to provide plans from them. Every competitive advantage plan, health insurance company, Part D and supplement plan on the market, we are appointed to provide their products. So we're a one-stop shop, completely unbiased, because we're going to make pretty much the same commission regardless what company you choose. So our only interest is what's best for our clients. And we've been doing it for in April. We're getting really close to our 13-year anniversary. It's hard to believe that. April 1st will be 13 years here in Fayette County at the same location, 121 North Pittsburgh Street in Connellsville. Very proud of that. We're very, very thankful that the community has supported us for 13 years. Thankful for WMBS for helping me get my start. Sandy, George Von Benko, who wandered into my office, almost,
Well, sometimes George just wanders around.
Well, George is marches to his own beat, I guess. But, George loves me to say that, he likes to brag. And it's true. George wandered into my office, probably going to be, I'm going to guess, June maybe 12 years ago. And needed some insurance and talked to me about advertising on his show. And next thing you know, Sandy's at the office and we're chit-chatting, and next thing you know, I'm doing What's on Your Mind, and I think you're my, I've been through 4 hosts, which is not bad over 13 years, right?
Not
that
bad,
says something about
the
state.
Radio, no.
Yeah. So, we started way back when. So, thank you to everybody. Thank you, Fayette County, and now moved into Pittsburgh and Forest Hills, and started out myself and my dog and a couple employees, and now we're up to 3 different locations and 15 or 16 employees. It's been a great ride. So,
and by the way, if you would like to contact Aaron in his office, you call 724-603-3403 or online at getyourbestplan.com. But if you would like to talk to Aaron right now, it's 724-438-4593, or we are live streaming this both hours on our WMBS Facebook page, and so you can make a comment, and we'll answer your comments there on our WMBS Facebook page. So many, many ways to get in touch with you here on What's on Your Mind and a Medicare A to Z with Aaron Zolbrod. And as we are talking about Medicare, of course, the annual election period ended over a month ago. Why am I still seeing Joe Namath? Those commercials are still ubiquitous. I like to use
I'm
words
going to
like
try to say this without getting myself in trouble.
Okay.
How do I say it? There's a reason why they're still advertising.
Okay.
There is a reason because there's still business to be done out there.
And it should be fair. It's not the only commercial, and they're still touting the same things.
Right.
The free, the meals and pick you up at your doctor's office.
It's really strange that I can't mention why that ad is running. If you want to know why, you can call us directly, and we're allowed to tell you. This is one of the Medicare has some of the strangest regulations. I can't name Advantage Plan, Medicare Advantage Plan companies. I can't name Part D companies by name. I can't even say their name.
Right.
Okay? I can't even say so-and-so sells, XYZ sells. I can't even say they sell Medicare Advantage plans. Can't even mention their name. I'm not even allowed to mention a company's name in a letter I send to my own clients. So if they have company X, I cannot send them a letter and say, hey, your company X is having these changes for the following year. Now, I can say your current plan, I can't even mention their name, which is insanity to me. But meanwhile, Joe Namath can go on the TV and say, you can get $148 of your Medicare Part B premium back. You can get this. You can get free that. You can get free, without mentioning that you could also get bills for $7,500.
Right.
But he can do that, but I'm not even allowed to send my clients a letter mentioning their own company that they have. Imagine if I was a State Farm agent and I couldn't send you a letter and say,
State Farm's got a new policy.
I could. Can you imagine that?
No.
I don't understand it. Again, some of this stuff really needs reformed. And Medicare Advantage plans are now They're 2005 they started, so I mean they're 16 years old, and not much has changed as far as regulations and how they work, and they certainly could use some reform and some new regulations, so guys like these ex-football players can't go on TV and tell you all this fun stuff you're going to get without mentioning what else could happen if you get sick. But to answer your question again, there's business to be done.
Yeah.
Even though it's not annual election period.
All right. Speaking of which, what is the annual election period? Explain what that is, just in case somebody.
Sure. So annual election period is kind of a free-for-all, as I like to call it. It starts every year on October 15th and runs through December 7th. It's 53 days only, which is not a lot of time. But this is the only time of the year you can do whatever you want as many times as you want. So you can switch from an Advantage plan to a supplement to Advantage plan. You can switch Part D plans. You can drop Part D. If you can sign up for as many Advantage plans as you want during those 53 days, or as many Part D plans as you want, and the last one you apply for is the one that is going to go into effect January 1st. So this is the time when you look over what the new plan benefits are going to be for the following year, and that's very important. Because this is the only time you see what your plan benefits are going to change, what they were in 2020, in this case, what they were in 2020, what they're moving to 2021, and often there are a lot of changes. And so this gives you the opportunity to switch to another plan If you see that your current plan isn't as good as it was, had some changes you didn't like, you can move to another plan, or maybe your plan didn't change, but some other plan came in the market and undercut everybody on price and copays and ancillary benefits and this and that. Super important with Part D. So people who buy supplements have to buy a standalone Part D plan, prescription drug plan. People on Advantage plans get that with it. These things change. This is one of the areas that needs reform so bad, is Part D, because these companies have figured out how to game the system, man. Right. They have figured out how to get around the regulations that are supposedly there to protect consumers. I'm telling you, they know how to do it. And it's really important that those people look at that every year. So that is the 53-day period. And again, is a free-for-all. You can do anything you want. It's a very important time. Far too often people do not look at their plans, do not have them compared. They've had them forever. Oh, great, it went up $2. It didn't go up at all. Leave it at that and just renew, because you don't have to do anything if you want to renew. You just sit tight. Right. And maybe you'll get a new card with, if your copay's gone up at the doctor's gone up $5 or down $5. But generally, people should always be looking at that, and that is the time they can do it.
By the way, do we tend to look at only how much it's costing me per month and just hanging on? It only went up $2
yeah,
a month. Because other things change too.
It's a huge mistake, Yeah. Again, over the years, I started doing this back in 2008. And, there's been 3 or 4 years where we really had some very, very significant changes overall in the Advantage plan industry, overall in the Part D industry. And the change from 2020 to 2021 was one of those 3 or 4 years that are going to stick out to me forever. Or I'm going to go back and say, you remember that year that so-and-so company did this, and you remember that year that all the companies did this, or the 2-year period where they did this. Do you remember when, this company was so popular and then made this dramatic change, and we were this change from 2020 to 2021 was one of those years due to some significant changes in some out-of-pocket costs in what, plan that's been very, very popular in our area forever. The changes they had made. Part D has never been more confusing.
Boy, that's hard to imagine.
From 2021 to 2020 to 2021, it had never been more confusing, more goofy stuff going on. Again, and that arises from companies who have figured out how to game the system to maximize profits. And that's why it's important to have an agency like ours. And here's where I'm going to pat myself in the back a little bit. That keeps track of this stuff, that warns our clients of what they need to be aware of moving forward from one year to the next. That we send these letters out where I can't mention their company's name. I have to say, the plan you currently have is having this change, or, it's vital that you have this Part D company. It's vital that you get in touch with us.
So talk to us about,
so we can recommend a different plan and warn you of these things. And
again, that's the advantage of going with somebody like the health insurance store, because you're also up on all the new plans, all the changes. And if there was a piece of paper for every one of those new plans and the new changes, it would probably be a stack as high as your building, if not higher. So it's a lot of stuff to go through.
Right.
So give them a call, 724-603-3403, or online at getyourbestplan.com, and set up an appointment. And again, observing all COVID-19 precautions, doing a lot of Zoom meetings, a lot of on-the-phone meetings, things like that. So give them a call, set it up, and call us here at 724-438-4593 if you have a question. If you are about to turn 65 and you're going into Medicare for the first time and trying to figure out what you have to do, it's not confusing at all.
No, it's not confusing at all.
They'll be able to
especially with all that stuff coming in the mail.
Yeah.
And all those commercials on TV.
And they know, boy, do they know you're turning 65.
Oh, they can. I mean, I can buy those lists right now. You could, Bill, you can if you wanted to. If you wanted to start a business, and you wanted to market to people 65 to 68, from 65 to 85, from 50 to 50. You could to market to age people 51.
Yeah.
You can buy those lists.
In this zip code.
In this zip code, in this county.
Yeah.
Sometimes you can even narrow it down to what income brackets. I mean, it's incredible the amount of information that's out there on you, and that we can narrow down those searches. I used to do that years and years and years ago by those lists. I don't anymore. It's just
you've got enough people coming to see you.
You're right. Well, it's too overwhelming anyways.
Yeah,
I mean,
you're
getting. I would love to know the number of pieces of mail each person who's turning 65 gets between 4 months prior to turning 65, the month they turn 65, and maybe the month after. I would love to know the number of solicitations in the mail that those people get. I'd also love to know what the average number of solicitations people who are already 65 get, from like September through January. It would be incredible. The amount of pieces. I would love to know that.
But then again, don't save every piece of mail.
No, you don't need to. I would just wish I knew,
Yeah.
There was some way to keep track of that, because it would be a staggering number.
I would imagine so. And I know people that are it's like in the 2 or 3 pieces in the mailbox every day. Speaking of turning 65 and going on Medicare, I have a question there, but we also have a couple of callers.
Great, let's take them.
So let's go, 724-438-4593. Hi, you're on Medicare A to Z. Who are we speaking with here? Hi.
Hi, my name is Roberta.
Hi, Roberta.
Hi. Aaron, I just want to let you know I just retired July of last year, and I was 64 when I retired, and I am beginning to get flooded with calls about what you're saying.
Right.
Not too much in the mail, but the phone calls. Why I'm calling today is I have a question. I'm not going to buy from anyone but you. I'm going to make an appointment to come down and see you. But my question is this. My pension place, Peasers, is giving me $100 a month.
Oh, yeah. So you're a retired public school worker,
yeah.
Correct? Awesome.
Yeah.
Okay.
Now, Aaron, how does that work? They're going to pay for my insurance, my employer is, till I'm 65.
Okay.
And I give them that $100 every month from Peaser until that point.
You're going to continue.
Now, what happens?
Okay, so they're gonna transfer you over to the Medicare plan at that point.
Yeah.
So you're gonna get a new packet. Actually, you should be getting that packet, or you might have already gotten it. If you haven't gotten it, you're gonna get it any day, any time now. I thought I heard they send that out 6 months prior to turning 65. So you should be getting that any time. It's going to be a HOP packet. It's called they call it HOP, HOP. And you're definitely, if you get the $100, you're definitely going to want to get a plan through them. I will show you.
Okay.
I will show you which plan you want to get. We still encourage you to make an appointment for that, and I will show you which plan. I will show you which plan to take. We recommend teachers 100% of the time to do the same thing. We recommend you take the HOP. It's called HOP Medical, and they're going to give you the $100 towards that. It's probably the best value in Medicare there is on the market today. When you turn 65, it's only going to cost you like $66 or $68. It's going to be some of the best insurance you've ever had in your life. Now, what we're going to do though is we're also going to probably put you on a prescription plan outside of HOP, because as good as the HOP medical plan is in value, the prescription plan is probably one of the worst values in Medicare.
I see.
So the prescription plan is way overpriced. I don't know if that's how they make up for, giving you such a good medical plan, is they overcharge you for the prescription. But you don't have to take the prescription portion. You can take just the medical, buy your prescription through us, get it through us, and we'll walk you through that step. But you should be getting that any time now.
Well, you know what? If it came within the last 6 months, to be quite honest with you, I probably pitched it.
No, it comes 6 months prior to you turning 65. So
so it should be coming anytime.
Anytime, and it's going to be. It's a pretty big packet.
Gotcha.
It's a pretty big packet. It'll come in a white envelope. It's a big one. It's not a small one. Don't throw it away. It's very important to have all your brochures. Your application that you fill out and send in will be in there. Now, are you collecting Social Security or not?
I am collecting Social Security. I've been deemed disabled, so I'm Social Security disability.
Okay, so you already have your Medicare card, or has it not been 2 years yet?
It's not been 2 years yet. I just retired July of last year.
Okay, so you'll get your.
Been deemed,
Okay, you're going to get your Medicare card automatically mailed to you. You said July. You turned 65 in July.
I turned 65 in July of this year coming up.
Okay, so
21.
June, May, April, mid-March, your Social Security, your Medicare card's going to arrive automatically.
Okay.
Mid-March.
Okay.
So you're going to look for your HOP brochures to come anytime. You're going to look for your Medicare card to come mid-March. If you don't have your HOP brochure by the time your Medicare comes, call HOP. Tell them to please mail you out the packet. I actually can print the applications up from my office. So, I mean, it's not necessary. But when you get your Medicare card in the mail, call and make your appointment, and we'll walk you through that entire step.
Okay, Aaron, I have another question.
Sure.
I'm on 4 maintenance drugs, and I have to be on oxygen all the time.
Okay.
Is this HOP good for me?
Absolutely.
Okay, that's what I wanted to know.
Absolutely. You betcha. Yes, it will be.
All right, Aaron.
Okay,
all right,
honey.
I'll wait for that to come, and I'll give you a call. How soon? Not till March, right?
You can sign up 90 days before. As soon as you get your Medicare card, honey, you could call and make an appointment you can sign up in April. You can literally sign up for any plan in April. You're going to get your card in March. So when you get your card, call up, make an April appointment for April. Everything will be taken care of. You're very, very easy to take care of because of the HOP option, which is fantastic.
Awesome. All right, Aaron. Thank you again.
My pleasure. Thanks for the phone call.
As always, you answer all my questions.
Bye-bye. Thank you, dear.
Thank you all. Bye-bye.
Thank you, Roberta. And if you'd like to join it, by the way, if you want to call and set up an appointment with Aaron and with the health insurance store, 724-603-3403. If you want to talk to Aaron right now, 724-438-4593. Hi, you're on Medicare A to Z. Who are we speaking with? Hi, you're on with Aaron. Apparently it's...
Hello?
Yes.
Yeah, hi, you're on with Aaron.
Oh, okay. I got a question about this Medicare. Now, I belong to Senior Life.
Okay.
And started coverage at 8/1/2008.
Okay.
About a month or so ago, I went down to Rite Aid to get a flu shot.
Mm-hmm.
And they said they can't take this Medicare on account of Senior Life.
Correct.
Is that true?
Yeah. So this is a really good call. So what you have done. So what Senior Life is Senior Life is pretty much their own Medicare Advantage plan. So what you have done is you've chosen to have Senior Life not only be a place that you go. Do you go there quite a bit during the week and get your meals and that?
Not now on account of that COVID.
Okay, so what you've chosen to have Senior Life be your insurance company. Basically, they're responsible for paying all your medical bills, not Medicare. They are your medical and your prescription drug provider. And so you can only use their doctors and their pharmacy to get these things filled. And they're the ones that decide what, if you need an MRI or you need a CAT scan or if something is medically necessary. They are your insurance company. So if you...
Well, that medical card is no good to me?
That Medicare card. So what you do when you choose Senior Life, when you choose a Medicare Advantage plan, you are choosing to have Medicare, that red, white, and blue card, the original Medicare, take on a completely different role than what it was originally intended for back when it first started back in the early 60s. That Medicare pays 80% of your bill generally. That's how Medicare works. So instead, when you join Senior Life or when you join another HMO or PPO, you are choosing to have Medicare take on a completely different role. And now Medicare is paying Senior Life X amount of dollars a month to become your insurance company. They're paying Senior Life to take on the burden of providing all your care. If you need a doctor, Senior Life has to pay for that. If you need a surgery, Senior Life has to pay for that. When you have medications, they're paying for those medications. Okay? So if you wanted to have more choice, then you would want to, you would not want to have Senior Life. Now, Senior Life, I've toured it, and it can be very good for people. Again, this is sad that, COVID is, because part of the reason why people want to go to Senior Life is you can take your laundry in and have them do some laundry. You can get fed your breakfast and lunch. They provide some entertainment for the day or programming or things to do and that kind of stuff. They have some exercise equipment there. So all of those things are nice. But if you're not utilizing those things, then it may not necessarily be the right fit for you. If you need some extra care, it really works well for people who are, disabled or wheelchair bound or need that help during the day. It's not necessarily for people who want to be a bit or who are more independent and want to have choices of which hospital and what doctors they can use. So, if that's something you'd want to consider again, you can give us a call and we can discuss the,
Okay. Do you think if I get a doctor, it'd be same thing?
No. I mean, so if you were to get a different insurance company, you would have access to more than, at more pharmacies, to lots more doctors and hospitals. You'd be in a little bit more control over who you see, when you see, where you can see them, et cetera.
But not Medicare.
Well, if you went to original Medicare, you could go to any doctor you want. There's nobody to tell you who you have to see or when you can see them or what's going to be paid for. When you use Senior Life or you go to another HMO or PPO, another Medicare Advantage plan, those people have a much more control over how you get your care, where you get your care, when you get your care, what care you can receive. Okay, so those are all things that you want to talk about. I would really encourage you to maybe make an appointment and have somebody like a son or a daughter, a niece or nephew, or a good friend sit down so we can discuss this and make sure that Senior Life is either A, the better choice for you, or maybe it's not the better choice for you.
Oh, okay.
Okay?
Now, I want to know, I suppose I'm not entitled for that extra Social Security pay.
I'm sorry, what is you referring to, sir?
That extra, they claim extra.
Extra help?
Extra Social Security money.
You mean where the state, when the state pays your Medicare Part B premium?
Yeah, probably, yeah.
Okay, so some people qualify for extra help for the state to pay their premium and so on and so forth. That will have no bearing on if you can move from Senior Life or not. And again, we'll evaluate all that. We'll evaluate, what programs you do qualify for. If you're not already signed up for them, we'll help you. We can help you do that. If you're qualified for PACE or PACE-Net, which we're going to talk about here later in the show. But, somebody like you who's not able to actually use Senior Life for some of the most important benefits, which is, being fed your meals, having your laundry done, being entertained, having some, stuff to do, which they're very, very good at. If you're not being able to take advantage of that and you don't know when, it might be something for you to look into, and then you can always move back that direction again if they open back up to the way they were. But I think it's very important that people understand. I think a lot of people don't understand what that program is designed to do, essentially, and what your, all the great good things that they can provide, versus how your care is delivered, versus being on another type of plan or another Advantage plan or a supplement. Very, very important.
Okay, another thing, I got hearing aids.
Uh-huh.
Do I have to pay for them batteries?
That would be a question right now that you'd have to ask Senior Life.
Senior Life?
Yes. If they're the ones that provided you those hearing aids.
Okay.
If you had a different plan, a lot of times hearing aid batteries are something that is a benefit that you can get through some ancillary benefits. But if you need a hearing aids, you want to know, again, everything you have question on regarding your care, regarding your benefits, needs to be referred to Senior Life while you're still with them, because they are your insurance company.
Oh, okay.
Okay. Not only is that a place that you go, they are your insurance company.
That's what I figured.
Yeah, and it's a very confusing concept and hard for people to understand. But man, this is a really, really, really good phone call.
Okay, bud.
Thank you.
I appreciate it.
My pleasure.
Thank you, sir. And,
Thank you.
Okay, remember to give Aaron a call at 724-603-3403. That's the office number for the health insurance store. And if you would like to talk to Aaron right now, 724-438-4593, or you can make a comment on our WMBS Facebook page, and we can answer that as well. Now, we were talking about Medicare, and if somebody is like our caller earlier who is turning 65, but the open enrollment period has passed, first thing off, do you have to make a choice during the open enrollment period, or just once you're turning 65?
That's a great question. Very confusing. A lot of people think, okay, the annual election period's here in December. I'm turning 65 in May. Do I have to do this now? And the answer is no. So when you turn 65, you're in what's called your initial election period, which is the 3 months prior to the month you turn 65, the month you turn 65, and the 3 months after you turn 65. That's called initial election period. And you can make a choice anytime in those 7 months. And you have some special, exceptions during those times. One is you can go on a supplement, and it's one of the only times in your life, generally, that those who are going on Medicare or turning 65 for the first time can go on a supplement without going through what is called medical underwriting. When it doesn't matter what your health is, they have to accept you regardless of what your current or previous health is or has been. Advantage plans you can go into and out of all the time because they don't have underwriting. So if you want to go from one HMO to another, you can, no questions asked. However, if you want to go from it, if once you're past 6 months past getting Part B, be that turning 65 or going on Medicare Part B for the first time, Medicare companies can deny you acceptance into their plans based on your current or previous health. And they ask you a series of medical questions to determine whether they want you. That's the first thing they do. Then they also look at something called your Medical Information Bureau, which consists of every code that you've had in a certain period of time that insurance company has submitted a code for reimbursement. There's people that are trained to read those codes and know what that diagnosis was or what you were seen for or what treatment you received. And they can say, that's a code for chemo. That's a code for, renal, kidney issues. That's a code for this. They can see what prescriptions you've taken, that have been paid for. So that's how they determine whether you qualify or not. It's such an important time is first turning 65, and it's why it's so important to see a broker who not only has access to all companies, but also both supplements and advantage plans, because the worst mistake you can make is listening to what, over-the-fence advice. Well, my neighbor has this, and she said she loves it, or my, brother has this, and they said they love it. Listen, you don't know what they've got. You don't know if they're getting insurance through HOP, because the person who called can also get an HMO or PPO from a couple different companies that basically have almost no copays and no out-of-pocket costs, where you could take the same company's plan and be exposed to $7,550 in bills for the same and receive the same service that your neighbor did, and they didn't get any bills. Well, of course, they're going to say, I love this plan. John had cancer and he got chemo and radiation, and we never got a bill. Well, guess what? You would get bills for $7,500, possibly. So, again, don't listen to that stuff. Use the experts, that have been doing this for 13 years, that have helped, 15,000 people. Let us take care of that for you. But that was an outstanding phone call, one of the best we've had in a long time.
And by the way, as we have said many times, the initial meeting doesn't cost anything.
Yeah, we do not charge ever for initial meetings, for just quick phone calls. If you want to email me and ask questions, we do not charge for an initial meeting or a second meeting or third meeting. Lots of times we meet people with once, maybe, then we meet with them again, and it might be a third time before we actually enroll them in a plan, and that's fine. There are no charges for consultation.
724-438-4593. We have someone else who would like to ask Aaron a question. Hi, you're on Medicare A to Z. Who are we speaking with?
Hey, Aaron, this is Michael. My phone call, I suggest, is going to trump the previous phone call.
All right, Michael. You always have good ones, buddy. We're ready.
No, you need to be sitting down for this one.
Okay.
Last Thursday, and I will give you some backfill information. I've been battling this from being exposed to uranium and other chemicals over in Iraq now for 17 years. I almost died in the Uniontown Hospital emergency room December 6th of 2016. When I went out 2 weeks later for the diagnosis, I was told I had 4 years max to live with cardiac sarcoidosis. It's a death sentence. And so the Cleveland Clinic's not number one in the country. They're number one in the world for heart and vascular. So I go in there, and they do things straight up. And I got my vaccine. I got a Moderna vaccine. And then I go meet my electrophysiologist, Dr. Wozni, and then I go meet they do everything on a team basis, you know. And so I go meet and see the results of my PET scans and my biopsy. I sat down. The resident looked at me. He said, "My God, we rarely see this. You had 2 years to live. You're now in remission. You are in remission." And guess what they did? 20 of them lined up, and as I left, they all clapped.
Oh, that's awesome.
Yeah. So, anyways, that was a game changer, and I tell you, no. So basically, people say, "How can I go to the Cleveland Clinic? How can I go to Johns Hopkins? I'm on Medicare." You absolutely can. Okay. And so I would be dead today. In fact, they put the paddles on me in the Uniontown ER, and I took out my scapular and prayed to the Blessed Mother. I said, "Please help me, Blessed Mother." And the nurse said, "Oh, my God, it's in God's hand." I said, "Hey, doc." And he was a young doc right out of his residency. I said, "Inject me with Cardizem, which is a rate control drug." My heart rate was 235 in the ER. And so the reason why I tell you that story, God's not good. God is great. But the number one, God only helps themselves who helps them help themselves. So the reason why I'm calling you, I just had an 86-year-old woman who's on one pill come over here, and she got messed over. Now, I can mention Medicare Advantage plans, right? You can't, right?
Well, I prefer you don't say the name of the company, but, you know.
So they're the ones that own the Taj Mahal on Fifth Avenue.
There you
all right?
go.
And they're the ones that Josh Shapiro had to get involved and basically be a referee between the other evil giant in Pittsburgh, okay?
Right.
And so anyways, her nephew unwittingly dropped her out of the Aetna Advantage Eagle plan that pays the $40 refund back every month.
Right.
And she goes, "Oh, my God, oh, my God." I said, "Just let Sadie help you." So one of your own, Sadie, helped her. And so this story I'm telling you is because people absolutely are so afraid. After one of your best, Sadie, okay, helped her. She got 2 letters in the mail from Aetna saying, they basically say, "Okay, we've submitted your application to Medicare." And then she gets another saying, "You've now been approved, and you need to keep this letter to take to your doctor." And then she actually gets the card. She says, "I'm so confused."
Right.
I said, "Hey, Mary, please, please. I'm on a high here. I just won money on the Mega Millions. Okay, please don't ruin my day, okay?" You know what? I didn't even know how much Mega Millions was when I stopped by the Exxon station there on Main Street. They said it's $2 a ticket. I said, "Give me 6." And so, whatever. So I'm on a roll.
There you go. Can I ask you a question? The person who got switched off of one plan to the next, how did that happen? Through a broker? Did they make a phone call?
Well, what happened? What happened is that I took Mary down to meet Sadie along with this other 84-year-old veteran, and Sadie tried to talk him out of UPMC for life, and he goes, "Oh no!" So that's where he's at. The other one, she goes, "Fine." She says, "My husband, may he rest in peace, his employer through either U.S. Steel or somebody was on Aetna, so she had a long history with Aetna. All right." And so then her nephew, trying to be a good guy, he says, "Oh, I'm going to try to save you money on your prescription plan." I said, "My God, Mary, you have PACE."
Right.
She goes, "I didn't know I had PACE." So let me tell you the other issue I'm calling in, because there's more than one people have this problem. My mother and then my next door neighbor, they have a Medicare Advantage plan, a supplement plan. And they both picked up the Aetna plan for $7.30 to go along with their PaceNet card, okay? Aaron, you still
yes,
there?
I'm with you. Mm-hmm.
And so guess what Hicks and Boss told us? That the system through PACE will not allow them to bill Aetna first. And I said, "You know what? That's not what I do for a living, so I'll run it by Aaron." So I'm telling you, there's at least 2 people now are having the same problems and using their Aetna SilverScript plan with Hicks and Ball Drugstore in Uniontown on Morgantown Street.
So, and there's so much information out there, and to defend Hicks and Ball's or other drugstores, they just may be getting wrong information there. I mean, PACE works the same with all prescription drug companies, and the problem is PACE sends out these crazy letters to people that makes them think that they have to have certain Part D plans in order to have PACE. Which are totally misleading. They shouldn't do that. I've made calls. It's just there's what you're saying, Mike, and we've covered so much territory. And, with the last call and your call, it's confusing. We've talked about PACE and how it works with Part D and then Advantage plans and supplements. And can we go to Cleveland Clinic? And
well, let me tell you what they all understand. You know how Mary left my house today? She was so thrilled that she got $90 of free stuff.
Right.
From Aetna. She goes, "Oh my God, I got a blood pressure monitor for $40. Oh my God, I got Depends pull-ups."
Right.
And I said, "Hey Mary, do you prefer boxers or briefs?" She goes, "Depends." I go, "There you go."
Yeah, I mean, and you just mentioned
that's
something
a joke.
else.
You're supposed to laugh.
I think, Mike, the great call that you made, and I appreciate it. We always appreciate your calls. Is that let us handle this for you, right? Don't do this on your own. Don't count on your son or your niece or your nephew to do it.
Well, that's why I sent him to Sadie. And so the reason I'm telling the story, I don't know how you get past these people's mindset other than literally walk them through the process until they raise their comfort level. And you've got a good team there.
Right, we do. Sadie, you mentioned Sadie. She's awesome.
Yeah.
All right,
I'll let you go.
Yeah, appreciate it, Mike.
Bye-bye.
Boy, we really got a lot of calls today. It took up the whole hour. We're down to a couple minutes. We're going to try to get to after the break. And listen, I just assume take calls for 2 hours, and we'll get to this. We'll get to this next time. But what we're going to try to get into is, again, what do people do when they're turning 65? What about people who are still working after 65? We want to talk about people who are already on Medicare and what happens if are they stuck right now after the election period's over. We're going to talk about medications, very, very important. We're going to talk about some prescription assistance programs. So if you're somebody who's hit the donut hole in the past, we're going to talk about what the donut hole is, describe it. And if you're somebody who's on Medicare and have been really killed by high prescription drug costs, we're going to talk about some ways you can avoid that in a whole long list of medications, including a ton of diabetic medications that are now free for a lot of people in this country right now, and who you can make some, quite a bit of money and still qualify to get your diabetic medications and others for free. We're going to provide that list of those and get into whatever we can in the next hour. Obviously, we want to take your phone calls too. Like I said, your phone calls are what drives this show, and so keep them coming, and we'll be back here shortly. Again, if you want to get a hold of me, you can email me personally if you'd like to at my first name, which is Aaron, Aaron, at Get Your Best Plan. You can go to our website and see. We're going to be putting up our webcasts and podcasts again. I had to take some of those down because I made an insurance company mad, and they put some pressure on me to take some of those down. We're going to be re-recording those, the ones that I made some statements, I guess, that made them upset. And putting those back on. Me? Can you believe?
Really?
We're going to start putting those columns back on. I do run a column in the Post Gazette every Friday, which is going to actually on page A2, and in the Trib on Tuesday, page A7, called Ask the Medicare Specialist. You can find those on our website. And then if you want to call and make an appointment or just talk to an agent like Sadie or Jen or Lonnie or myself, that's 724-603-3403. We look forward to the second hour coming up here.
Hour number 2 is up next. It's Medicare A to Z with Aaron Zolbrod from the Health Insurance Store on your local station, W266DB WMBS Uniontown. Uniontown Hospital Studios at your local station, 590 AM, 101.1 FM WMBS. And this is What's on Your Mind? Medicare A to Z with Aaron Zolbrod, brought to you by the Health Insurance Store. You can always call the Health Insurance Store at 724-603-3403 or online at getyourbestplan.com. You can also email Aaron directly through the getyourbestplan.com website. We also haven't mentioned that you're also on several social media platforms, Facebook, Are you tweeting yet?
I don't do tweets.
You don't do tweets.
I'm not a tweeter.
But you are on the Facebook page.
I'm on Facebook, and that's it. That's the extent of I don't Insta-chat or Snapagram or
at least not yet.
Whatever that stuff is. No, Facebook's all I can handle.
Well, if you would like to talk to Aaron right now, you can call him at 724-438-4593. Again, 724-438-4593. If you have a question about health insurance, whether it's your own personal health insurance, business health insurance, we can answer those questions. We spent the first hour taking phone calls, which were all great calls, a lot of great information coming out of those calls. But we were also talking about the annual election period, which has already passed, but that doesn't mean if you're turning 65 that you can't apply for Medicare, you can't apply for a supplement or an advantage plan.
Right. It's very important that we talk about how important, going on 65 or going in Medicare Part B for the first time. So let's talk about the process real quick for those who are turning 65, like Doreen, our wonderful gatekeeper of WMBS and the phones. And
she runs the joint.
She runs the joint. We all know who runs the joint, basically, yes. Brian and Doreen run the joint. We know it. But anyway, so let's take Doreen, for instance. So she's working. She wants to go on Medicare at 65, but she's working, so she's not collecting Social Security. Those who are collecting Social Security don't need to do anything to enroll in Medicare because you'll get your card automatically about 100 days before the first day of the month you turn 65. So in Doreen's case, if she were already collecting Social Security, her Medicare card would have come because she turned 65 in May. Her card would have come to her like in the last week or so. But since she's not collecting Social Security, and people who are working normally don't, because once you make around $17,000, every $2 you make over $17,000, they take $1 back from you. So you don't want to work for free or for half price. So basically, those who are working past 65 don't collect. Well, she needs to go ahead and apply for Medicare A and B. It's not going to come to her automatically. Right. And during the break, we were seeing if we could create an account for her on socialsecurity.gov, and so we can apply for Medicare A and B only, and then that card will come to her. So again, if you're collecting Social Security and you're turning 65, do nothing. Wait for your card to come. Again, about 100 days before the first day of the month you turn 65. So keep, you're going to get bombarded with stuff. A lot of people just start throwing it all away and thinking, oh, here's another thing from, here's another solicitation. They throw their card away. Look for that. It's going to come. It's not a regular standard size envelope. It's like a 8 by, I think it's the, I don't know what a standard envelope is.
I think it's 5 by 8.
5 by 8.
Yeah.
Is the bigger one, right? I don't know what the other one is, 3 by 8 or whatever
it's
it
like
is.
half of a letter size
Correct.
Piece of paper.
So it's going to come in that size from Social Security, not from Medicare. Your Medicare card doesn't come from Medicare. Your Medicare card comes from Social Security, and it's in a bigger envelope, about, like you said, about half the size of a normal sheet of printing paper. And it's going to come in there. Again, those like Doreen who aren't going to collect and are waiting, then you need to physically apply for that. And then once you get that card, or even before, if you want to come sit down with us, we'll go over your options, talk about how Medicare works, talk about your two options, which are supplements and advantage plans, how each work, the pros and cons of them, get a feel for how you want to insure yourself, if you're more conservative or if you're more a risk taker, what medication you're taking, do you travel, all of those things are going to help us determine what plan we might advise you to take.
So if you need to, if you're getting close, again, just call them at the health insurance store, 724-603-3403. And of course, COVID-19 has not made anything easier, because it used to be you could go down to the Social Security office and meet somebody face to face.
It's made it much, much more difficult.
Right.
Especially those people who have worked past the age 65, which was one of our next topics to get into, which, more and more people today are working past 65 with the economy and, needing to work longer or wanting to, if you enjoy your job. And if you're retiring after 65, most of those people have applied, already had Part A, and now they need to get Part B. And this is where the Social Security office not being open for face-to-face meetings really comes into play, because you can't just wander in there. I used to tell people, hey, just show up at 5 to 9 before the doors open. Be the first or second in. Somebody will see you within 20 minutes or a half hour. You won't wait long. You don't need an appointment, and you can get your Part B. Well, you can't do that anymore. People who have Part A need to apply for Part B. There's a form that needs to be filled out by your employer or your spouse's employer that says you've had insurance since you've turned 65. That needs to go to Social Security in order to get your Medicare Part B anytime you want, and without paying a penalty for late enrollment. So that has to be done, and that process, again, takes much more time. So those of you who are working and are going to be retiring this year, please give us a call. We'll walk you through those steps of that before we even start talking about what your options are. We got to get that process moving and get that Part B. We'll walk you through that. We have the forms that you need to get that, to get Part B. We can supply you with those, tell you who needs to sign what and where, what phone calls you need to make, what needs to be mailed in and where. We'll walk you through that process. It's not simple.
No.
Okay? It's only simple for those who are already collecting Social Security. That's who it's simple for. Your card comes, no problems. Everybody else needs to do some applying, and those who have Part A only are working past 65, or their spouse is working past, or your spouse is working when you're past 65. That becomes much more complicated. Pick up the phone. We'll walk you through that. We'll make it really, really easy for you.
If you are working past 65 and you receive your health insurance benefits from your employer, is it on a case-by-case basis, or do they generally pull the plug when you're eligible for Medicare? How does that work?
You do not have to take Medicare Part B when you turn 65 when you're eligible, if you're working or your spouse is working. Again, not everybody should opt out of Part B.
Right.
I'd probably say 75% are best keeping their insurance through their employer, but that depends on how much it costs you. Okay, if your employer is only paying 50% of your health insurance, you could be paying $300-400. If you're paying $300 or $400 for it, or if you're paying $250, $250 or $300 and have a big deductible, you could be better off opting out of your insurance at work and taking Medicare. A lot of times, it's best for the employee to stay on, but it might be best for the employee's spouse to stay on the employer plan, but it might be best for the spouse. Right. If he or she's 65 to go on Medicare. Because,
generally you end up paying something for your spouse's care.
Right, and it could be more. A lot of employers will pay for the employee at 100 or 75 or 80%, and the employee at maybe only 50 or 25 or maybe nothing. Listen, don't guess at it. Here's a tip.
Yeah.
Don't guess. Call us. This is a 5-minute phone call or less. Hey, I'm turning 65. My husband's still working. We're getting insurance through them. What should I do? Find out what it costs for both of you to be on it. Find out if it only costs for your husband to be on it. We want to know what your deductible is. We want to know what your coinsurance percentage is, which is the percentage of the bill you pay after the deductible's been met. And we want to know what your out-of-pocket maximum is. And we want to know what medications are taking. That's the information we need to know. If you give me that information, in less than 5 minutes, I can tell you who should stay on the insurance at work, who should go on Medicare. It's that simple. That's all the information that we need. Don't guess at it. Don't do it yourself. Don't throw darts. Again, you can call us. It's always free. You can email me. There's never any charge for that. It can be very, very confusing for somebody who's not in this business. It's stuff we deal with every day and stuff I've dealt with for 13 years.
And for instance, you just reeled off a bunch of different numbers. What's this copay? What's this charge? You have access to these companies, and
I don't have. So now that's a great point, because I don't. Yeah. Every employer, just because somebody, and I can mention companies who have employer plans, just because one person has UPMC or Highmark doesn't mean it's the same for the guy that works out at that works at
somebody that works at a plant, or
somebody works at the glass cap. At the cap plant in Connellsville, doesn't mean it's the same as somebody who works out at the envelope company in New Stanton, or that works at UPS. That UPMC can be different. I can design my group plan in 1,000 different combinations, and so it's not what you have. I need to know what your company offers, because I don't know from one UPMC or Highmark plan to the next. They can be really, really different.
And so, basically, bring your paperwork. If you can't figure out what it is, bring your paperwork in with you.
Or you could call your HR and ask those questions. If you don't know what to ask, call us. I mean, listen, I just rattled off 100 different things.
Yes.
Acronym, out-of-pocket maximum, coinsurance, copays, those are all foreign to people. I get that. Just like if you had an auto insurance person on here and start talking about tort and stacking, and I don't know what you're talking about. You can rattle that stuff off to me. My brother-in-law has tried to explain that stuff to me again. I said, bro, just tell me what insurance I need.
Yeah.
I don't want to hear about this. I don't understand it. That's what we're here for. I don't expect you to understand it. I know I'm throwing out a lot of those things. we'll go through those. If you want to know the details of those things, certainly we can explain them in a way you can understand. It's almost impossible for me to do over the radio and the amount of time we had in the topic we're on today. That could be a good subject for another day, is talk about the differences between co-pays, co-insurance, deductibles, and out-of-pocket costs. Maybe we'll do that someday. We're not going to do that today.
No. 724-438-4593 if you want to talk with Aaron. And if you have any question about health insurance, we are again at the beginning of 2021 and the new cycle of medications and the donut hole thing really. Can we just touch on that quickly, what the donut hole is and what we're encountering right now?
Yeah, so let's talk about the Medicare prescription drug donut hole. It's a bad word. It shouldn't be called the donut hole. Donuts are good. It should be called they're not good for you, but they sure are good.
They're the perfect food.
Right.
What are you talking about? Yeah.
It should be called the black hole because that's where your money goes
There you go.
once you get in it. So let me explain it to you. In 2021, I believe the number this year is $4,130 or $4,150, around $4,100 in retail medications you can receive. It's not what you paid for it, your copays or anything like that. It's the retail cost. Once you've received around $4,100 worth of retail medication, you fall into that donut hole. Somebody's going to say, "Oh, $4,100, that's a lot of money." No, it's not. Yeah. All these fancy diabetic medications that you see advertised on TV that make you want to think that like diabetes is something happy and fun.
Really? Let's go to the park and play with balloons.
Yeah.
Yes.
Those drugs are between $500 and $800 a month. So are almost every other name brand medication right now. The average retail cost of a name brand medication now is $500 to $800. So if you divide 4,000 by 800, that's 5 months. You'll hit your donut hole in 5 months. If you're taking one $500 medication, you're going to hit your donut hole after 8 months. What happens once you get in that donut hole, you go from paying a small copay of maybe $30 to $45 or $47 to 25% of the cost of that medication. So if you're taking an $800 non-insulin diabetic medication like Ozempic or Trulicity or, again, the songs they sing, people are mowing their lawns, they're dancing, they're pitching horseshoes and smiling. And I didn't know diabetes was that fun.
Oh, it's magic.
Yeah, I didn't know the diabetes was that fun. Maybe I should go get diabetes. Anyways, don't get me started. You could end up paying $200 a month for that drug after 5 months. Imagine that shock, Bill.
Yeah,
Someone new to Medicare, 65, hasn't been explained to them the donut hole. They're used to paying $45 for that drug a month or $100 for a 90-day supply, chugging along, $45, and June comes. They show up at the pharmacy. Someone says, "That'll be $200, please."
I'm sorry, what?
Huh?
Yeah.
That's the donut hole. Okay, it's not a good thing. We were told back in 2013 it was going away. It was one of the biggest lies in the history of government. It went away in name only. They're now calling it the coverage gap. It's not technically called the donut hole by the federal government, and that's how it went away. It's actually gotten worse for people in the last 2 years than better. It was supposed to gradually go away until there was no donut hole. It's a lie. And people are paying more money out of their pocket now than when they did just a couple years ago. It's very upsetting to me, but it is what it is.
Now, the question therefore comes, how do we avoid it? And for instance, if you're on PACE or PaceNet,
the PACE or PaceNet's the easiest way to avoid it because it pays through PaceNet pays through the donut hole. You're still in it technically, but PaceNet is picking up that difference between your small copay of $9 or $15 and the $200 that you would have paid for Ozempic or Trulicity or whatever that is. And so that is the number one easiest way to do that, because once you get into PaceNet, you don't even have to re-enroll. What they do every year is they check your tax return to see if you still qualify, or if you don't file because you just get Social Security, they have access to your Social Security, how much you got on Social Security, and they just keep renewing you. So it's one of the best programs that we have, and what I love about it, it's paid for by the lottery. So it's not taxpayer funded necessarily. The proceeds from the Pennsylvania lottery go to paying for this. And so don't get mad when that person's in front of you at the convenience store and you're trying to pay for your gas, and he's going, box me 122 twice, and I'll play this number straight and wrap this around, and I don't understand all that stuff. I really don't play the lottery a whole lot.
Yeah, basically, give me the Mega Millions.
Right,
tickets.
like Mike said, give me 6 Mega Millions and be on my way. Don't get mad at those people. They're paying for your pay stat, okay? They're helping seniors.
Well, you can still get a little annoyed. I think.
Yeah, but that's where our other states use their lottery income for different things. Pennsylvania, I think, does a great thing with it, and has the PACE program.
Now, are there different income levels for PACE? I mean,
there are, and I'm not going to get into full. So there's full PACE and there's PACE Net. I'm not going to get into PACE because if you qualify for PACE Net, you might qualify for PACE. There's not a ton of difference, so I'm not going to get into that. So let's give the income limits for PACE Net. That income limits are $29,235 if you're single, $29,235 if you're single, and $38,970 if you're married. Now, if you go on the website, you're going to see some lower dollar figures. I'm adding back in Medicare Part B because they don't count what they take out of your Medicare Part B. So when I add that back onto the 27.5, that's how we get to the 29,235 and the 38,970. So if you're told, oh, it's only 27.5 and 35.5, it's not. The real numbers are 29,235 if you're single, $38,970 if you're married. Okay? We will help you qualify, determine if you qualify. We will do that application for you so it's done correctly, and we will make sure it's processed and that you're approved for it. PaceNet is wonderful. The people that administer PaceNet are contracted. They're not government employees. They do a fantastic job. You can be approved for PaceNet in a matter of 2 or 3 days. You get your card, well, depending on the mail now.
Yeah.
If the mail was running
normal,
you'd get your card within a week of applying if you're approved. It is a fantastic program. It's run extremely well, and it's life-changing, to be perfectly honest with you.
Yeah, I know somebody who takes, I guess I can say this, takes Eliquis.
Yeah, you can say it.
And they got to the last month of the year, got to December, and all of a sudden the bill came. You get that little notification from the pharmacy, your scripts are ready, and it's $661. And they went,
I can't afford it.
Yeah, well, and they were already on PACE.
Oh, okay.
You need to tell the pharmacy.
Oh, yeah, you need to make sure they have that card.
Yeah.
So they know to look it up, and so they know to enter that.
And they're not going to automatically look it up.
No, I mean, if you don't provide them that card, they need to know that you have that. But it can be life-changing, especially for diabetics. I mean, completely life-changing.
Yeah, exactly. $15 a pop.
$15 is the most you can pay for any brand name medication. Where somebody who was taking 2 medications that were $600 a month. They normally would pay $300 for 6 months. They would only pay $30 a month for that. I mean, it's a huge thing.
So, go ahead, play the lottery, Mega Millions, keep building up that jackpot.
That's right.
Keep on.
Nobody
going.
hit it?
No, they're both still still unclaimed, as they say.
Wow.
So, hey, that's a good thing if you're on PACE.
Right. Absolutely.
More people in line at the convenience store. All right. Whether you're on PACE or not, what are other options we have if we can't afford our Medicare?
Sure. Let me go back real quick to PaceNet, and I want to make sure everybody knows that assets aren't considered when you're applying. So if you have a 401k but aren't collecting yet, if you have money in savings, if you own some property, your homes or autos aren't included in that. If you have some stocks, some CDs, it's only what's on your tax return. And we're looking back a year. So we're not looking at what you're making today. We're looking at what you're going to make in 2021 or what you're making today. It's based on now if we apply, it's based on what you made in 2020. Right. So if you were denied in 2020 or 2019 or 2018, don't let that stop you. You might have some dividends. Right. You might have some sort of inheritance that was taxed that when you applied last time. You might have hit the lottery that had to be reported. Yeah. You get hit a $2,200 jackpot at the casino, and you have to report it, and that could put you over. I don't qualify. Last time I applied. No. Let's look at it. Okay, this is tax season. You're going to be filing your return for 2020. Let's take a look at it.
Yeah, make a copy.
You can make a copy, scan it to us. You can, just white out, black out your Social Security number or whatever. You can mail it to us, email it to us, fax it to us. I can tell you in 30 seconds if you qualify for PaceNet, by looking at your tax return. It's very, very, very simple.
And now, are there other assistance programs?
Yeah, so I really want to talk about what's called patient assistance programs. Okay, patient assistance programs. These are not government programs. Right. These are programs that are paid for by the drug manufacturers. Okay, and trust me, they can afford it. Go Google top 10. Go Google top 10 profit. Go Google
profitable companies.
Profitable drug manufacturers in the United States. Your jaw will drop when you see how many billions of dollars in profit these companies are making each year. Trust me, they can afford to give you medications for free. So the patient assistance programs, again, you can make between, generally the most common ones, you can make between 300% to 400% of the poverty level and still qualify for these patient assistance programs. They also don't take into account your assets. And because they're not government programs, they don't have access to check out your tax returns and all that stuff. And to when you send them the information, you can send them your tax return. Sometimes you don't need to, you can send them your Social Security statement. So I'm going to be careful how I word this, but there's nobody there to gotcha. Okay. Yeah. That if you there's nobody. So it's a lot easier to qualify for these. First of all, because of the income limit. So it's $38,280 for a single. If at 300%, it's $38,280 for a single person, and just under $52,000 for a married couple. At 400% of the poverty level, it's $52,000 for a married couple, and just under and around $69,000 for a married couple. Excuse me, $52,000 for single, $69,000 for a married couple. That's huge. Okay.
And they may have these programs in place, but they're also kind of hoping you don't hear
of course, them. God.
Which is why you go to an Aaron Zolbrod who knows about these programs.
Listen, this is stuff that we've done, that we've run into, that we've looked into for years and years and years. I am getting ready to hire. We are getting ready to create a new position. I'm calling it our prescription drug caseworker. This person is going to be the go-to, who every time we have somebody who's hitting the donut hole or having trouble with their medications, we're going to have them be counseled with this person one-on-one to find all the solutions, to find what we can do. And patient assistance programs are one of the best ways to do it. Again, I just talked about as much as $69,000 for a married couple and $52,000 for a single person. And because of the pandemic, this started with the pandemic, these medications can be free, and can be free right now. You don't have to spend X amount of money. You don't have to wait till you hit your donut hole like you did in the past. Right now, your drugs can be free if you qualify for certain programs. There's 5 or 6 companies that are doing that.
Now, do any of these have age? PACE is restricted to.
This is not restricted to age. PACE is 65 or older. This is not restricted to age.
So you can, as long as you fit into the income level.
And you can have Medicare and still get it. It used to be these companies would not let you get it if you had Medicare. Then they started to lighten that burden, say, oh, okay, if you've hit your donut hole, or if you've hit your donut hole and spent X amount of money, then you can get it. Eliquis, unfortunately, not all drugs are qualified for this. So Eliquis is probably the most common brand name drug other than insulin that is taken in the United States right now. This is a medication that anybody who has a bypass, a stent, maybe a blood clot, a heart attack, a stroke, AFib. This is a drug that everybody takes. It's a drug like it kind of took the place of warfarin or Coumadin, so you don't have to go in and get blood work done every 2 to 4 weeks. You don't have to do it. It retails for almost $600. Mm-hmm. And unfortunately, they have this program, but you have to spend $1,000 out of your pocket before they'll help you. Well, guess what? You never get there. By the time you spend $1,000 up, it's November or December. Oh, maybe you'll get 1 month for free, but then it starts January, starts all over again, and it won't work. So, unfortunately, some drugs like Eliquis, some medications for breathing like Advair and some of those drugs, Unfortunately, Brio, they don't have these, they make you spend this money out of pocket, so some people will never get there. I'm talking about these patient assistance programs where you can get these drugs free right now. You get this application filled out, you'll have your drugs delivered to your house in 2 to 3 weeks if you do the applications and get them filled out properly.
So give Aaron a call at the office, 724-603-3403. And if you want to ask Aaron a question right now, especially about things like the Doughnut Hole, like PACE, like patient assistant programs, give us a call right now at 724-438-4593. We got another 15 minutes or so there's still plenty of time to take your calls. And you brought up the high cost of medication, some of these specific medications, and we know of some medications like cancer treatments that's like $10,000 a dose and things like that. Is this going to change, or is this something we're going to have to live with? How do we change this? What can we do about this, about the high cost of medication?
It's going to be, nothing. You and I. Yeah. This is going to come down to, and it's not just those cancer medications, Bill. I'm because there are cancer medications that are $10,000. You can't tell me, you can't justify. I'm sorry, 30 pills or 60 pills that weigh what, half an ounce?
Oh, maybe and that's including the bottle,
right? Costing $10,000, right? Gold's $1,600. And you have to mine it, and you have to get equipment in. You've watched Gold Rush and how much money and time and effort it takes to mine an ounce of gold. You can't tell me that drugs $10,000 unless somebody's hiking. I've said this before. Hiking into the Himalayas or into the jungles and fighting off tigers, and snakes, and to dig up a root that only grows in certain parts of the Amazon where few humans have ever been. I just don't know how you can justify charging $10,000 for a quarter of an ounce of whatever it is.
And half of that's filler anyway.
Yeah, I just don't get it. But I'm more concerned about these now these again all these new fancy spangled diabetic medications that are $800. You just can't justify it. And especially when if you look in Canada what these medications cost. In every other country in the world, they're a fraction of the price. So in the United States, if it's $800 and there's not a generic yet available anywhere in the world, it's $300 in Canada. If it's $500 in the United States for insulin, it's $100 in Canada. How do you justify that? Well, it's your politicians that are on the take, that are protecting these corporations.
I'm shocked that drug corporations are contributing to campaign funds.
Well, it's funny because, it's always big this, big that, big this, right? What was it first? It was big tobacco. Right? Then it's big oil.
Right. Now it's
big pharma. Now guess what's the new big? Big tech.
Yes.
Right?
And we're discovering
if you
that
think
as
these
well.
So we're going to see why probably nothing, and I don't want to really get political, but why nothing's going to happen and these monopolies are going to get up with big tech. Who did they donate most of their money to? Campaign. Who did it go to?
The winners.
The winners. Do you think the winners are going to stab these people in the back? Oh, you just gave us millions and millions of dollars for our campaign.
I guess we can put off regulating.
Listen, and it's both parties as far as big pharma goes. It's a joke.
They're covering all the bases.
And do you know what's funny, Bill? We'll hear this. We hear it all the time. The one people bring up. How about that? The EpiPen. Yeah. That was a joke. That was some schmuck who thought he saw an opportunity to buy a company.
Right.
The only probably drug company he could afford to buy was the manufacturer of an EpiPen. He raised the price out significantly.
Like 600.
Okay. Well, guess what? Insulin's been raised 500% in the past 5 years, but you don't see that. You don't see those manufacturers up in front of Congress. They found this schmuck that hadn't given nearly as much money to campaigns. They brought this guy up there as a dog and pony show and pretended they cared, grilled this poor guy. No, I'm not going to say poor guy. He was a jerk.
Yeah, when he jacked up EpiPen,
he deserved it.
Defend him,
but then how come you didn't bring the the Mercks and the Novo Nordisk and the Lillies and the Johnson? How come you didn't bring those guys up to testify when they raised?
We'll show you the canceled check.
Right, insulin 500%. There's a hell of a lot more people on insulin than are allergic to bees that need an EpiPen. So again, to answer your question, we have to keep hounding your politicians to do something about it. I don't know if they will.
Especially if they run on it and then they get in office.
Yeah, and you know what's the sad part is boy, I was waiting. Trump had started to make some. I'm not going to get into this. I'm not going to get into. He started to make a little bit of headway in this, and I think he was slow walking it because you can't just run in and take on this behemoth. They're so powerful.
There are only so many Davids that can.
And I'm curious to see if the next administration is going to take this kind of keep this going. The only way is going to be some regulation and smart regulation. And it doesn't have to be a lot of regulation. It could probably be pretty simple. And ask yourself, why in Canada, why in England, do they pay 20% of the costs that we pay in this country?
724-438-4593. We have a caller on the line. Hi, you're on with Aaron. Who are we speaking with here?
Hello, my name is Denise.
Hi, Denise.
I have a question.
Certainly, dear.
I'm getting ready to be 65 years old this year, in a couple of months. And right now, the kind of insurance that I do have is from the welfare, disability.
Well, that's a good question.
And I'm wondering, do I need to do anything? Because I'm a little bit worried. I'm going to make sure.
Are you on Medicare now, honey?
No, not yet, but I think they're going to.
This is an outstanding, another great question. I don't think we've ever had this question before. So your qualifications for medical assistance are totally different pre-65, not on Medicare, to 65 on Medicare or Medicare due to disability. So when before you're 65 and not on Medicare, the qualifications to get medical assistance, you can make 138% of the poverty level or less, and you can have as many assets as you can have. Again, you can have as much money in savings and checking. You can have stocks, bonds, 401ks. You could have non-residential property. You could own 2,000 acres of land, and you still get medical assistance. When you go on Medicare, you can only make 100% of the poverty level, which is a significant difference, and you can only have $2,000 in assets, which would include checking, savings, even cash value of life insurance policies, stocks, bonds, and so on and so forth. So there is a very good chance that you will not qualify for medical assistance for Medicaid when you turn 65. So I would suggest you make an appointment. Let us assess that for you, figure out what's going on, and hopefully you do qualify for medical assistance still. And if you do, there are special Medicare plans that are specifically designed for people who qualify for both Medicare and Medicaid, and they're called they're plans that are called SNP plans, special needs plans, and they're also called dual plans. And dual means dual eligible. You're eligible for both Medicare and Medicaid.
Okay, because I'm on SSI.
Okay, right. So again, I believe the medical assistance to get 100% medical assistance is just under $1,100, or right around $1,100. It might be like $1,097 or $1,107, right in there. I can't think of it off the top of my head, but it's right around $1,100. But I would highly recommend you make an appointment with us and let us go over that with you, show you what your options are, what plans you can get, because it is definitely going to change, honey. Okay.
Okay, because I'm on all kind of medications and stuff.
Well, so let's say you don't qualify for medical assistance, dear. Like you may not qualify for full medical assistance, and you're just over the limit. That's okay, because there's PACE, which the income limit is quite a bit higher for. PACE and PACE-Net that you qualify for. So the worst case scenario is we know you're going to qualify for PACE-Net, honey. We know that. And so the worst case scenario is those expensive medications will be $15 or $9, and then there's all sorts of different levels of help from Medicaid to something just above that where they'll pay for your Medicare Part B premium, and also you'll pay the same for your prescriptions as you are now. And there's like 5 or 6 different levels, honey. So we can determine that for you. Okay, we'll walk you through that whole process. Don't get panicky. Okay, definitely don't get panicky. You're not going to go broke from medications. It's not going to be a complete hardship. Trust me. Okay.
Okay.
I know for a fact that if you qualify for medical assistance pre-65, the worst case scenario is you're going to qualify for PACE-Net once you're on Medicare.
Okay.
Okay, dear?
Okay, thank you.
Thank you. Great phone call. Thank you so much.
Thank you, Denise. And if you want to give us a call, We have about 7 minutes left. 724-438-4593. And this is sort of kind of dragging you back into the political reign, but just for terms of definition, one of the things we heard a lot, especially in the primaries, was the phrase Medicare for all and universal health care. Has anybody actually come out with a definition of what they're talking about?
Well, I mean, I think they could be two different things. I mean, universal health care to me is Canada. Right. Okay, like you're born and you get health insurance.
Right. You know, your taxes are paying for it, but yeah.
You're born, you can go to the hospital, your Social Security card is your insurance card. Right. That's Canada. Okay. Medicare for all is a little different. Would be, you know, Medicare pays 80%. If they kept it just like it was, you'd go out and get a supplement to pay the other 20. Or if they decided to go with an Advantage plan style where you chose to privatize your Medicare, you could choose a private insurance company instead instead. So they're two totally different things. I'm not sure. Well, I definitely don't want universal health care because it leads to a shortage of doctors, can lead to rationing of care like they do have in Canada. Anybody who tells you they don't is not.
I know doctors in Canada who say that they're given a budget and that's it. And usually I talked to a heart surgeon that said, in my county, we had budget for one open heart surgery for the entire year.
Yeah, so, I mean, you just don't we don't want that. Medicare for all, I think, maybe could work. Again, watch out for you wish for. It really have to be done well because the problem with Medicare is doctors don't get reimbursed as much. And, you know, that could be an issue. Again, those are the differences. We'll see where we go there. I wouldn't mind seeing maybe Medicare move back to 55. I think that could be a really, really big thing because it's the people that are 55 and above that really use healthcare more.
You know, we're
and
starting
kind of,
to get, yeah.
And that kind of cost those younger people some more money maybe to make up for those other people. I think that might be able to work. Again, I'd rather just see us have a more market-based system, but I don't think that can happen unless we have A, lower prescription drug costs, and B, transparency in what. Again, this was something Trump was working for, that hospitals have to tell you what that stuff costs before you get it. What does this MRI cost me without insurance? What's it cost me? Right. What's chemo cost me in my worst case scenario? What's a day in ICU cost me? We don't know these things. We're not going to have it. We can't have a successful market-based system, in my opinion, if we don't have that transparency in costs. Before we're finished, Bill, I want to list the common medications that people can, that are free right now if you qualify for these patient assistance programs. They're very common. Do we have a caller waiting?
We have a caller waiting.
I'm going to list these real quick. We're going to get to that call. If you want to know these again, call me. I'm going to try to put them on my Facebook page here shortly. Tresiba, Levemir, Novolog, Victoza, Ozempic, Forteo, Basaglar, Humalog, Trulicity, Ferixa, Brilinta, Symbicort, Januvia, Asmanex, Apidra, Toujeo, and Lantus. Tresiba, Levemir, Novolog, Victoza, Ozempic, Forteo, Basaglar, Humalog, Trulicity, Ferixa, Brilinta, Symbicort, Januvia, Asmanex, Apidra, Toujeo, Lantus. If you're taking any of those, there's a very good chance they can be free right now today. If you want to call the office, we'll talk you through it.
There's a computer somewhere coming up with all these bizarre names.
I don't know what that, right.
How do they come? All right, let's go to the phones. You got about 3 minutes. Hi, who are we talking with here?
Hey, my name is Charlie.
Hey, Charlie.
And I want to thank you, Aaron, for educating me on this stuff.
You're welcome, my friend. That's the goal.
I caught something when I was in my vehicle running out to the drugstore, something about PaceNet income. I thought it was, is it $34,000 for if you're married joint?
It's $38,970 if you're married and $29,235 if you're single.
39.8?
It's 38.9, right? Just a tad under 39. Let's call it 39,000.
Okay, 39. And then what was this? You kind of confused me about this 69,000.
Okay, so that's for patient assistance programs because a lot of people aren't going to qualify for PaceNet. So all those medications, did you listen to that list of medications I just rattled off while you were on hold? If you make, there's a really good chance, if you make, if you're married and make between 52 and 69,000, many of those many or all of those drugs could be free if you made, all of them would be free if you made under 52,000. Lots of them would be free if you made under 69 and you're married. And it's huge because insulin kills people, and now non-insulin dependent injections, the Ozempics, the Toujos, all of those, the Trulicities, the Farixas, those are the ones that are killing people because they're like $800 a month, and people are getting in their donut hole so fast, and we're paying $200 for those. They're free, and they're free right now.
Right.
You don't have to wait till you hit your donut hole. So those people who are going to have a deductible first thing in the year, they don't have to meet that deductible.
And that donut hole, they converted it from a donut hole to what was it called?
It's called a coverage gap. It's the same thing, man. It's just a way of BSing us so they can technically say it's like I did not have sexual relations with that woman, right? Okay. It did go away. It's not the donut hole anymore. Well, it's still there, right? It's just called the coverage gap. But we didn't lie.
Yeah.
Because the donut holes went away.
No lies at all.
Right. Do you know what I mean? It's technically they didn't lie. They lied, but they, covering their butt, CYA, right? They just,
right.
You know how politicians are.
Charlie, thank you for the call. Be safe.
Hey, thank you.
Hey, we'll talk to you soon.
Bye-bye.
And we have less than a minute to go. It's been a great couple of hours. We'll do this again in 2 weeks.
2 weeks, man. 2 weeks.
If you want to get in touch with Aaron at the health insurance store, 724-603-3403, online at getyourbestplan.com. And with that, I notice you're wearing the Penguins.
Penguins got their first victory yesterday.
First victory against the dreaded Washington Capitals. So
yeah, the Flyers got us good.
Yeah. Oh, well, let's not talk about that. Anyway, so we'll be talking with you again in 2 weeks. Again, if you want to get a hold of him, 724-603-3403. This has been the Medicare A to Z with the health insurance store with Aaron Zolbrod on your local station, W266B WMBS Uniontown.